name's Nurse Anthony. We're gonna do an assessment today. Come on in.
All right, how's it going? So you doing all right? Good, good. My name is Anthony. I'm gonna be a nurse today. So can I get you to state your name and date of birth for me, please?
Will Tweedy, 33199.
Okay, can I see your armband, please? All right, sounds good. And what I'm gonna do, sir, is Yes, sir. Also, I'll let you know what I'm going to do. I'm going to do a head start assessment on you today just to check all the different systems of your body. That's okay? Sounds good. All right, so can you do me a favor? I want you to say your name again for me.
Will
And you know where you're at?
Jones,
Okay, and you know the time right now.
September.
September. All right, sounds good. And I can see, as I can see now, the patient does not wear any glasses or any hearing aids, so everything is intact. All right, so sir, what I'm going to do now is I'm going to assess your pupils, and what I'm going to do is turn the light off, so I don't have any interference. All right. All right, pupils were assessed. They are round, black in color, equal, and they're both reactive to light. About 3 millimeters in size. So, also, sir, do you have any pain or anything like that today?
Not too
No pain? Okay, good. All right, so what I'm going to do is I'm going to turn this light on, and then we're going to assess your skin. Is that okay with you? All right, sounds good, sir. So what I'm going to do is I'm going to let this rail down so I can better assess you. All right, sir, what I'm going to do is assess your, starting from like the neck down, skin. All right. So skin appears to be dry, smooth and dry. Color is beige with yellow undertone. Uniformity of skin color, no abrasions, bruises, or tears. Assessing the legs. Legs also appear beige with a yellow undertone, dry, moist, no bruises, scrapes, or scars. Skin is all intact and all uniform in color. So what I'm going to do next, sir, is I'm going to check your skin turgor. So I'm going to go to the left mid-clavicular line. All right, and skin return immediately. So now, sir, what I'm going to do is check your hair. So assessing the patient's head, hair color is brown, clean, thick, and also check the hair on the body. So on the arms, we have brown, even hair evenly distributed. Also have facial hair, which is brown. Assess the legs, which we also have brown hair that is uniform. And so what I'm going to do now, sir, is I'm going to check your lung respiration. Is that okay with you? Sounds good, sir. All right, so what I'm first going to do is, well, before doing that, let me assess your respiration rate. So just lay back, and what I'm going to do is I'm going to count for a minute. And while I'm counting for that minute, I'm going to assess how many respirations he has within that minute. So, sir, we can start now. right, so I got you at 12 respirations a minute, so that's within the normal limits, which is 12 to 20.
Was not noted, but respirations were regular with
Listen to your lung sounds on your front, so your anterior part of your body first, just to check to see if I can locate any abnormalities. So, sir, what I need you to do is just take a deep breath in and out at each point. Alright, so what I'm going to get you to do, sir, is just sit up for me so I can assess the sounds in the back also. Okay. Alright, sir, so it's just the same procedure for me. Alright, deep breath in. Deep breath out. Good. 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 Great. Good. 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 Okay. 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 Good. All right. Okay. One more time. All right. One last time. Good job, good job. All right, so I assessed the anterior and posterior side of the body. I did not indicate any abnormalities, no wheezing. Sounds were all regular. So lungs also were, no indications of wheezing or anything like that. So sounds like that you're good, and everything sounds good biometrically. Even so, all right, now, sir, what I need to do is assessment with your heart rate. So what I'm gonna do first is I'm just gonna take a radial pulse this time. Right. Okay. So I'm gonna count for 1 full minute, starting now. So, sir, I got your radial pulse at 63 pulses per minute. It was bounding, so it was pretty strong and also regular. And so the normal limit for that is 60 to 100. So you're doing good right now. You're within normal limits. So what I'm going to do now, sir, is I'm going to assess your epical pulse. That is located in the between the fifth and sixth. Intercostal joint, the midclavicular line, right there. So, sir, I'm going to use my stethoscope, place it there for 1 minute, and count your heart rate. Actually at 66 beats per minute, which is also normal. Range, which is 60 to 100. Alright, sir. So now that we've done the radial and apical pulse, what I'm going to do is I'm going to set your pedal pulses, okay? Alright. Okay. Good. Okay, so pedal pulses are present in both lower extremities. They are both bounding, regular, and bilaterally symmetrical. So you had a good pulse in both of them. I felt them. So what we're going to do now, sir, is we're going to set your blood pressure. Is that okay with you?
Fine.
Good. So okay, what I'm going to do is I'm going to get my blood pressure cuff right here, and we're going to make sure it's not too tight on him. Is it comfortable for you, sir? All right, what I'm going to do now is I'm going to locate the radial pulse. You got it? And I'm going to inflate my cuff until I stop feeling the radial pulse. All right. So it looks like I stopped feeling the radial pulse at 132. So what I'm going to do is I'm going to inflate 30 up. And so now I'm going to inflate it up to 162. So, all right. And so now I need to locate the brachial pulse. Okay. Now that I located the brachial pulse, I'm going to inflate to 162. Looks like I got his systolic pulse, which is top number at 122, and a diastolic at 80, so 82. So that is within normal limits. For systolic, it is 100 to 140, and then for diastolic, it will be 60 to 90. So it looks like you're as healthy as an old rock. All right, so now that I got your blood pressure, what I'm going to do is I'm going to check a capillary refill. So check it right here, return instantly. Okay, also I'm going to check it toes. All right, they both returned instantly. So capillary refill returned instantly in both upper extremities and lower extremities. They're all symmetrical, and so it's all normal right there. And then also the nail beds of the feet and fingers, index, middle fingers were all pink. So that's a good sign right there. So now what I'm gonna do is, let me just check it from time, okay? Earlobes is appropriate for skin color, for ethnicity, so, and then your lips are pink. Good, all right. So Now, what I'm going to do, sir, is I'm just going to ask you some questions about your diet. Is that okay?
That's fine.
All right, sir. How often do you eat a day?
Let's say 3 to 4.
3 to 4? All right. So normally breakfast, lunch, and dinner, just traditional. All right. And do you normally consume 100% of your food?
All the time.
All the time. Good. Do you ever experience any nausea or no food allergies?
No.
Good. Good. Okay. And also, as I can see, you're pretty thin and kind of firm, so I can assume that you're pretty active and all that. Okay. And so, do you ever have any problems with bowel movements or anything like that? Have you had one today?
This morning.
This morning, good. All right. And then do you know if it was the consistency as far as firm, soft,
Normal.
soft? Okay. And that's a regular thing for you. Okay. And then I have bowel movements regularly, at least once a day. Cool. All right. Sounds good. All right. So what I'm going to do now is I'm going to inspect your abdomen first. Right. And so, looking at the abdomen, it appears flat. The contour is concave, so it's round. And so now that I've expected it, I'm going to listen to it, and I'm going to start in the lower right lobe. Alright, so bowel sounds present in all 4 lobes. And also now what I'm going to do is I'm going to palpate. Alright, so now that I've inspected, auscultated, and palpated, during my palpation I noticed that it was nice and firm, no abnormalities there. Everything seemed regular. Alright. So now what I'm going to do, sir, is we're going to work on some range of motion things. That's good with you? All right. Sounds good. All right, sir. So what I'm going to get you to do right here is we're going to just work on the head right here. So I want you to just try to touch your ear on your left shoulder right there. There we go. And do the same on the opposite side. All right. And now, sir, what I need you to do is I'm going to ask you to nod your head. Right. And then you can move it this way right here. All right, sounds good. And then you touch your chin to your chest. Good. One more time. All right, no pain or discomfort there. All right, cool. So before we get to your arms right there, I just need to ask you a few other questions, sir. All right. So do you have any problems as far as like with daily living things, or do you walk without assistance? You don't need any wheelchairs or crutches or anything like that? Cool. All right. And then you never have any pain or anything like that? All right. And then also, let me inspect your mouth. Okay. So, mucosal membrane is moist, pink. Teeth are all present. No abnormalities there. No odor present. So, now that we've got that done, sir, we're just going to work on the arms now. We're going to work our way down. All right, sir. So what I want to get you to do is I want you to raise your arm up.
Just one at a time?
Whatever you prefer. All right. Good. All right. And then one more time. Good. And if you can reach across your chest and touch your opposite shoulder. Good job. One more time. Good. All right. And what we're going to do is swing it out. Right here. Good. One more time. Good. All right. And what we're going to do is we're going to curl it. All right. Good. And then bring arm up, flex your wrist. Good. Okay. And then turn. All right. And then we're gonna squeeze. Spread. And then one more time. And now can you touch tips of your finger? That's good right there. All right, sir. So now what we're gonna do the same thing with that arm right there. So same thing. We're gonna go up. All right. Time, and you just let me know if you're feeling any pain or discomfort, and then there we go, sir. Right there, and we're gonna swing it out. Job. Let's swing it. Good. And now we're gonna rotate. All right. Spin our wrist. Spread. All right. All right. Everything seems to be intact. with your upper extremities. And so what I want you to do, sir, is I want you to grab this right here and squeeze as hard as you can both. All right, so grips equal and bilateral in hand. They're equal in strength, strong equally in strength, and the grips are good. So, and now what we're going to do is we're going to apply resistance with your top part. So what I want you to do, push against me, sir. Good job, and then resist. Good job. One more time with it like this. Good, and resist. Good. So strength applied were equal in both hands. They were both equally strong, and then the resistance were both equally capable of resisting pressure when pressure was applied by me. So now what I'm going to do, sir, is I'm going to assess your lower extremity. Sounds good? All right. So what I'm going to do now, sir, is I want you to go ahead and bring your knee to your chest, if able. Good job. One more time. Good job, sir. And then I want you to swing your legs out. I'm sorry. One more time. Good. All right, let's point. Point. Bring back. All right, sounds good, sir. Let me lift this up. We'll take it over this side right here. Same thing right here. Right. Good. All right, let's swing out. Good. All right, let's point. Bring back. All right, let's rotate that ankle right there for me. There we go. Inside too. Good job. I want you to squeeze both feet in. Yeah. Spread them. Yeah, all right. And what I'm going to do now is I'm going to ask you to apply pressure to my hands right here. So press. Good job. One more time. And now resist. All right. So pressure applied in both feet are both bilaterally symmetrical and equal in force, and also bilaterally symmetrical, equal in resistance. And as I was suspecting earlier, like doing full range of motion, we noticed that all joints were fluid and no abnormalities there. All were able to move through their full range of motion. No swelling or any abnormalities noticed during assessment. So now what I'm gonna do, sir, is I'm gonna want you to stand up for me, sir, and we're gonna walk. All right. So good. Good. All right. So no abnormalities with the gait noticed. Looks like you can get around pretty fine. All right. So let's assess your back. So if you've been over for me. All right. Spinal cord is straight, no curvature indicated. So it looks like you're a pretty healthy man. So if you mind sitting down for me, sir. Mind come around this way. Yeah, got the rails lower for you. All right. And so one thing. Yeah, I need to get one more thing from me. Pull on my hands for me, sir. Good job. All right, yeah. So equal strength in both hands bilaterally. All right, so after assessment, I can determine that the patient was physically healthy. The appearance was well groomed, clothes well dressed and pressed. Didn't notice any body odors or any bad breath. Also, what I'm going to do before I leave his bed, I'm going to lower it down to the lowest position. Right, and I'm gonna lay the call light by his side, make sure that the side rails are secure. I'm gonna perform hand hygiene. And that's a wrap.